Good. Thank you for being here. You're at the City of Laredo Blue Ribbon Committee for People with Disabilities meeting for Wednesday, April 16, 2025.
Mr. Garcia.
El Beyond,
Okay, we can. Well,
Yeah, they're at another session, so once they're finished with that one, they'll come up.
There's someone, apparently the lady is somewhere else doing another reading somewhere else, right?
Yes, they're in another session. Once she finishes, she'll come to us.
so is it gonna be on,
Yes.
yes or no? Yeah?
She's gonna be here, but she's late.
Okay.
Are you okay with that?
Say that again?
Are you
She's
okay
late.
with that? She's gonna be here, but she's late. Cause she's working on another meeting,
Okay.
okay?
Will you guys help me out, where you guys at?
Absolutely.
Yes.
Okay, so we are, the Blue Ribbon Committee for People with Disabilities, and call order. First thing is the approval of minutes for February 19th and March 19th of 2025, so you should have them on your website. Please read them, if there's changes, reviews, if don't need to make revisions, please let me know.
Mr. Chair, I only noticed that on the time, it says 10:03 on the call to order. I'm sure it was meant to be 11:03.
Okay. It must have been my spirit that was here. Thank you.
transcribe. Do you have the transcribe on your phone, the app? If you're Google, do you have an iPhone?
No, I don't have my phone with me.
Oh, you don't have
No,
your
I
phone?
don't. It's not that I
So
work.
the phones can help you transcribe whatever you hear. For instance, like this one, like it helps you listen to what people are saying, right? But you don't have your phone? No. I used to use this with my students. Alright, so, but there's other apps. There's an app. No, better apps out there, like there's
For those of you who are here, are there any changes or
yeah.
edits or anything? This time, Dr. Rivera also pointed out that you do notice that your minutes format was changed a bit. And so, what we're looking at is minutes review for February 19th, data review says March 19th. We're just reviewing them now, then it's April 16th, not March, so it needs to be changed. I don't know why you're doing
Go
that.
and write, yeah, can you?
Do you have a pen?
Yes.
Yes.
Let me write that down. So she said April. I apologize.
Oh, yeah, thank you.
You forgive us, Cecilia.
Please, I just came back from my show, please forgive me. Anything else?
The time that Jackie
Yeah, that.
mentioned.
11. Okay.
Okay, with those, including the changes that we made, do I get a motion to approve the minutes? For the ones for February?
Second.
Okay. And I have a second?
Yes.
Okay, so the minutes, will be approved as they are, except for the changes that the changes that need to be made to them. Those were the February, the March minutes as well. Any changes to March? If not, can I have somebody motion to approve?
I approve.
Good. Can I have a second to?
Second.
Thank you. So the minutes will be approved as they are, with the, except for the changes, including the changes that need to be made. Public comment, anyone signed up?
We need to take off the
No
whole
other
screen.
comments, no comments. Thank you.
He just needs to clear the
Can
screen.
you press OK, please?
To press on.
Press OK on the screen. You can put cameras on there too. Yes.
Okay,
You could put captions on that if you want to as well.
Maybe what?
Captions were in my other letters, but so.
I'm fine.
It's fine.
It's fine.
you okay?
Yeah.
As long as we got the interpreter, we're fine.
Okay.
There was nobody signed up for public comments?
No public comment.
Do you wanna, there's a number of people that are new, or it's just I have a bad memory, so if you're new, can you let us know who you are?
Who are you? My name is Mireya Lara,
I'm Roger.
and we're the parents of the child with autism, that's why.
Okay,
Happy you're here. Thank you.
Welcome.
Thank you.
okay. Anyone else? Y'all have been
We've been coming to several meetings already. Monica de la Cruz, Crystal de la Cruz.
Excuse me, just for your information, you can just speak a little bit louder so the interpreter can be able to hear you.
No.
Okay? The microphone's right in the back. Thank you.
And I think, Mr. Castillo, that we need to welcome Mr. Castillo because now he's part of the committee. Eric.
Welcome.
Who's Eric?
Right.
Okay, so we're looking for you right now, and we were like, we don't know, he didn't show up. Okay, so welcome.
I have a folder, but I didn't see it.
I asked Angelica, I said, did Mr. Castillo show up? He says, no, I don't know.
I'm right here.
Welcome.
Thank you, appreciate it.
Kathy asked.
No. Always.
That's what's next, look.
There you go.
So do you want to tell us a little bit about yourself?
Well, are you sure? Because I can speak for.
No. Sure, like, name and number.
The Reader's Digest.
Okay, I'll keep it quick and short. My name is Eric Castillo. I'm with ECI Project Niño. I've been there for 15 years. April 6th was my 15th year anniversary there. I've been working with ECI for, as a different roles. One of my first roles was a case manager, and then I did early intervention specialist, and eventually I became a speech pathologist assistant. And I've been doing that for the last 10 years, and then after that, they kind of switched my role to do public speaking. But Eric, you talk a lot, so we want you to speak to the community and do child fine coordination. So in the last couple of years, I've been doing a lot of child fine coordination. I haven't really practiced speech pathology assistant anymore, but that's one of my passions, and I'm really driven to help the community out with exposing them to these resources that we have at ECI and also the community, and making sure that we're able to connect the dots for a lot of the families that are in the community that are unaware of the resources that are out there. And I spoke to, what was it? Mr. Cadena last, at the proclamation for autism, and I noticed that there's a big need to share this information, and sometimes we miss out on families that don't know about these resources, and eventually they fall through the system, and this lack of resources. So we wanna make sure that we have exposure and awareness for all these resources, that we're all able to use those tools and cross-communicate and get that effective, intervention for all these families.
Thank you, Mr. Castillo. For some of us who have been like in the business for a long time, we know what ECI is exactly.
That's true.
Does everybody know what ECI is? It's your intervention program? Yes? Okay. I have a smarter group than I thought.
If not, I can do my 30 seconds.
The elevator speech, 30 seconds.
30 seconds.
Okay, well, let's go on to item 4, which is old business review and presentation provided by City Secretary Office regarding committee training. Okay, so I asked Angelica to send you all the PowerPoint presentation. Did you all receive it?
Yes.
Okay, was there anything that stood out that you all want to bring up? No? Okay. So then I guess we're good?
Okay.
Committee members update regarding their advocating for state legislature for installation of a psychiatric hospital as requested by OPD. Okay, so I wrote a letter, but I didn't send it to anyone. Okay, and I worked on it this morning as a matter of fact, but I can read you what I have so far. See?
Could you give a little background maybe? One of these meetings, the topic, and help me if you remember, the group was talking about how there's a need for a psychiatric hospital. And when we decided to meet with the police department also because we wanted to make sure that when a person with disabilities is involved with the police department, that there's no misunderstanding, because sometimes we don't respond because we can't hear, or we don't respond for whatever reason that we might not be able to. So we decided to meet with them and ask them, what training do you have? And do you need for us to advocate for more training for the police department? And what we found out is they have a tremendous training, and they're getting another that is a state approved, the one they're doing in Austin. For those of you who were there with the police police department. So they're improving their training, so that's already in place. However, they did tell us that what we need as a community is a psychiatric clinic or a psychiatric hospital, which a city this large really should have one. So that when there's this kind of a situation where maybe I'm on the spectrum and there's a problem and I maybe react behaviorally in a way that a police person may not understand or may misinterpret, it could escalate. And the police department talked about how, Richie talked about how sometimes a citizen like that could end up in jail.
Or killed.
And that's not
Or
appropriate.
killed.
And that's not appropriate. And so he reached out and he said, can your group advocate, write to whoever the powers that be, write a letter, talk to your congressman, speak to your representative. But certainly we should have at least a clinic. If we don't have a hospital with psychiatric care, then at least a clinic, so that we can prevent that misunderstanding from happening. And you're right, it could escalate to something awful that I don't even wanna think about, but.
Were you aware of the killing of autistic individuals that were confronted by the police? And one that I think was just a couple of weeks ago, or maybe last week, he was shot and he died. They disconnected him from life support, and he was autistic.
He was nonverbal,
Nonverbal.
and he had the capacity of a 5-year-old,
Yeah, but still autistic.
and
Yeah,
he was autistic.
yeah, they shot him. He was shot.
This is
I understand
precisely-
shooting once, but 9 shots.
Oh, wow.
This is just
This
lack
is
of training.
precisely what the police department is talking about and asking our help. That if any of y'all have any kind of connection to someone in the government that's in power, that they really need for us to advocate for a psychiatric, if not a hospital, at least a clinic, so that we can take care of our citizens who need that kind of a setting.
So, my experience of, my experience of like speaking to different representatives when we try to bring up any type of like legislative like policy or any type of grant or funding, the first thing that they ask for is like, where's the data, where's like the report? I think if the Laredo Police Department wants assistance, I think they will benefit from working with, Laredo Medical Center, Doctors Hospitals, and Border Region.
They
I
talked
used-
about that, sir,
I used
and they
to-
said that what happens is, since they don't wanna put this individual in jail, they'll go to the hospital, and what they tell them is, we don't really, this is not an appropriate setting, we don't want this individual to take one of our beds because they're limited.
Correct, and I haven't worked there in years, but when I used to work for the mental health clinic, I used to be on call and I used to go to the emergency rooms and do the evaluation for the individual that was having a mental health breakdown, right? So our job as a representative from like the mental health, organization was to go evaluate the individual, staff my case with the supervisor that's on call. Then I would staff it with either a private hospital or a state hospital, would be in the Valley or in San Antonio, right? Once I'm able to secure a bed for the individual, then we'll coordinate with the sheriff department to transport the individual. But the need for the psychiatric unit, whether it be within the hospital or a standalone clinic, like I agree with you, is there because I've been there when the doctors are when the doctors are like upset that the individual's taking up the room, especially if the individual doesn't have insurance, and the wait time can be anything from 3 days to 7 days when they're taking up the room, and
That's
like there's
exactly
that-
what the police department, what they were telling us.
Got it. So I mean, if they could, to help you all, like, if they could provide like the data, how many people are like, they're seeing in a month, like how many people are having crisis, and doing like work with them, with Border Region basically to obtain that information, it's gonna help when you go to representatives.
The gentleman who was asking for us to advocate, his name is Ricardo Gonzalez, they call him Richie. He's the Assistant Chief of Police for Laredo. So not only is he aware, but he's asking for our help.
But I think that's good information.
If I may add, I don't know if maybe we can consider the possibility, maybe having Senator Sapirini. She's a strong advocate for individuals with disabilities. I can outreach her, and maybe have her participate in one of the sessions that we have, or maybe have her come down and we can state our costs. And she's at a legislative level, so I think that she could possibly, I'm not, I don't know all the details of both legalities, but if there's a strong guidance, you can receive it from her. Yeah.
I think that, I believe, I actually 100% everything that you're saying, I've been through that process, working in the school system. However, I think in this case, what we're talking about is different than a mental health need. Like in this case, this kid was autistic and just needed a moment, like he needed to be regulated, right? He didn't need to be put in a mental hospital. He needed awareness from the police station, he needed trained police officers. So I think those are two separate things, to be honest with you. I wouldn't
And
want a
that's
kid
when we
who
started.
is having an episode to be put in a mental hospital. He needs to be regulated.
That's where we started. That was our motivation to go and have a meeting with the police department.
I think that's a good place for it to be,
Specifically for what
yeah.
you stated. And they had a unit of training, but then they call, and I don't recall, forgive me, Emma. What do they call that training that Austin approves and the Austin Police Department uses? I don't recall. I wish I did. But anyway, they're getting that new training.
Yes,
I would like to make a point that you mentioned, having the offices on. What I was glad about the Laredo Police finally has set up a unit for mental health. Just, because I'm proud of that.
Great.
I had a really good group with the mental police. So they say they don't have anyone. And they finally last year or 2 years ago, they finally set up a unit. I don't know if it's called a unit or
Yes, it's a
division
unit.
or department, whatever. And then they find they have issues still because they don't know, they don't have the resources. So someone who can provide information about understanding of mental health. Okay, how to work with individuals, how to deal with schizophrenic or so forth. So there are other issues that they have to understand. And the issue is that someone got shot, that 1 6 times. So it's why? That why? What was that fear that the police officer confronted with? So it's a fear of both ways, but it actually more awareness that you need.
I would like to add, I'm an officer with the Laredo Police Department. I've been there for 5 years now. Just so I just would like to add a little bit when it comes to that training that we do get a 40-hour training, which is a crisis intervention training.
Thank you.
So when it comes to that, we're trained to deal with patients or local citizens that are not just diagnosed with autism. It's like a broad term. So it could be anybody under the influence, anybody who's suffered from psychosis, any type of mental disability or anything like that.
It's a de-escalation.
De-escalation, but like I said, it's not just targeted for someone with autism. So when we go in there, we have like seconds, minutes to determine what that person is suffering or going through, right? Not only that, but there's different levels of autism. There's a mild, moderate, or the more severe cases, right? So like, I'm not defending what happened in Idaho in any form, but I just like to mention that I do recommend, or I do think that it's needed to maybe increase maybe the training. I know it's out of my scope or out of my area, but I do see that along with a lot of my colleagues, a lot of them are not really trained to deal with kids with autism when it comes down to it, only because not only I understand some citizens might be afraid to call the local police or deal with the police department because, like I said, maybe they don't want to escalate or there's not a lot of training to it, but I guess because my son does have autism, I have run into situations where I'm able to, distinguish, that person might be suffering from autism, especially when, like I said, there's one call, for example, there was a kid that would go into the Target and he would always go and steal and take a little car. Every day he would go after school, go and steal a little car. And one of my partners was we got into a foot chase and he was about to tackle him down and say, hey, hold on, he's autistic, especially for a little car that he's taking that's for like a daughter or two, you know what I'm saying? So I do recommend, right, if we feel that it might be, needed to, I guess not only, express these type of incidents or situations, but I guess recommend, to further train the officers if needed. But like I said, it is out of my scope, when it comes down to that, but it is just something difficult that we have to do on a daily basis, right?
Appreciate you being here, really.
Says here myself.
Yes, I guess in the line of training, I think one of the things the police department is doing is, I know that they've gone to LISD, they already, went over to ID, individuals, and I know that they're working with the Terror Center and doing that also. One of the benefits of that is the desensitizing of, individuals with disabilities who are no longer afraid of seeing an officer, because they see them as someone who has come over to provide a service rather than antagonize or anything like that. A lot of times, I was a teacher for 30 years, have worked with people with disabilities in the adult field probably for the last 12 years. And one of the things that happens is, if you bring someone in and they see them as someone who they can talk to, they're less likely to react. So that in itself is a training. I know that we hold the Night to Shine event, and the officers come in and they go, what do? I tell them, just be a friend, go dance with them. It sounds funny, but we do a great job at that, because there's a connection. I think there's steps taking place. There are also new funding that's going to come into the school
Yes.
districts to appropriate funding to train specifically for autism. And I think in line of that, if we can get a hold of someone who has the power to advocate, and I know that right now they're storming the Capitol with a lot of things that are going on, I think it would be a possibility to get something going too, where we can provide training as an auxiliary to the already existing grants.
And going back to the training, we've been doing the police officers training and we do the academy training, but there's also a form out there, and that's the form that I think we're missing. There's a form that the police officers, there's two things that they do. They take their IDs, and that's where they have all the information. The other thing that they do is that they have the form that's linked to the 911 system. This is a voluntary form that the parents complete, and it states, what triggers their meltdowns. They'll state that, so you write there, Tito, maybe the loud noises will trigger the meltdown. So make sure you come without a siren. So, and I think I mentioned this before,
Yes.
we're just missing the dissemination of that data. Whether we could go, and I think we could go through the schools, but again, voluntary basis. And then that way you get a 911 call like this happened in Idaho, and it'll flag the system, the 911 system, and it'll say, person with a disability or a person with autism. It doesn't have to have autism, but any disability. That way the police officers now, their mindset is very different
It's very
than,
different.
something else. Because LPB has been trained on how to approach the kids, that the kids are gonna go for their shining badges for their gun, they're gonna go through that. I don't know if this is what happened. LPD has also been trained that you don't say freeze, because they're very literal and they are gonna freeze. They don't understand the meaning of freeze. They don't understand. They think it's like, it's 100-degree weather, how can I be freezing kind of stuff. So, LPD has done that. With the mental health division, we've been working very close. Yes, they still need a lot of, monetary support, and it doesn't help that they keep changing the individuals. Okay, they keep being promoted, which is a wonderful thing. We're not gonna take that away from them, but we still then have to come and train. Okay, so get that information out there. The police department has that form, so that if anything ever happens and they're going to somebody's home, they'll understand, they'll know, and won't come in, blazing.
How do we access that form? How do we
I think we
facilitate?
have it,
We
right?
have the form, so we have, the family that, qualifies for the case management portion also. That is also provided to the family to explain the importance of that form, but with that form, we can't, as a program, send it.
Right.
Family has to, go in person, to provide that form, and so that the department has to.
Drop it off.
But the program also helps the families, with the form. Filling out the form.
I just wanted to add that, the mental health unit is only available Monday through Friday, 8 to 5. So anything that were to happen, like say in the evening or nighttime, they're not gonna be available. So not only that, like I said, these kids that are going through, mental crisis, most of them have not committed a crime. But at the same time, if the family can't deal with them, we're the ones that are there, that we have to make a decision, and the only place to take them is to a local hospital. Where I must add that they're already like stressed out and they don't have enough beds, and that's another, problem that we have to deal with, but I just wanted to bring it up that the mental health unit is only available.
So it comes back full circle to the letter that you have, so maybe we wanna hear your letter.
Well, I have a question. To access that form, why can't those forms be given to LISD, UISD when these parents, enroll their kids in school? They have access to that form and they can just submit it over to the.
Either
to
that
the
or
school,
opt out,
the
if they
school.
don't want to.
Because I think this meeting, you need to involve LISD, UISD, the fire department, and PD, and the sheriff too, because, so that they can also have a word.
LISD is here, so.
Yeah, we
she's
have
not here
UISD
today.
is her-
And
I'm
UISD
sorry,
is here.
I'm.
Yeah, we
here.
have the representatives, yeah.
So then why can't that form be given to the
So I was
parents?
thinking maybe post it also online.
I think
Well,
it has
not
to go
everybody
through
has
the-
access, not everybody's
Oh,
in
it
the, it's in the
It has
internet,
to
it's
go
in
through
the social media. I know I'm not in social
What we
media.
left off with the police last time was that they were gonna go and supply the applications or the forms for the parents. Parents need to give their consent, because my understanding is that they all, do they photograph the child as well?
Yes.
So they
Well, you have a
photograph-
picture.
they
Yeah,
For the
photograph-
ID.
Yeah.
Yeah, so they photograph the individual, so the family needs to give their consent for that information to be released to the police department. Police department puts it into their database. So apparently right now, the way it works is that they get a call, they actually have it in their database with the individual and taking the call from the dispatcher. Okay, from the moment that they put the individual's name, the system alerts them that that individual needs special care as a special individual.
How has this form been available?
We give it at every event that we have it
Okay,
here.
when did you, initiate it?
Oh, it's been like 2-3 years.
2-3 years.
Mhm.
And we
Yeah.
have program children with special health needs here at Laredo Public Health. When we have a new family, we do educate the family on the form and, guide them through the process and provide them.
Because the reason, because I used to be in the fire department, and I used to, two things I used to do. I used to also, check the fire forms whenever, from the other stations, whenever the report was done for fire, any fire incident, and then also EMS incident. And that's why I was wondering, I checked the forms, I would log into the 911 system, and some of that information was not available, but then again, I've been out already like going on 5 years, so that's why I was wondering that form, when was it available? And, the only thing I can suggest is, as when they're enrolling the kids, so that those parents, and whether they wanna sign it or not.
The process and the protocols are there already, they're in existence, okay? Is there anything we need to try to reinforce it so that every family places their child on that database to ensure that, for their own safety? But that's the concern. The actual system itself, the protocols, the processes are there, the police are more than willing to do whatever they can to alleviate and to potentially, avoid an escalation, unnecessary escalation to the point where somebody gets hurt. So they're being very
They're being
cooperative.
proactive also, cause in all the events that I've been doing outreach these couple of weeks and the LPD was there, they had the forms there when they were doing the IDs and they were educating the families also. So they're being proactive.
It's gonna be a process. It's a process.
Yes.
And I think if we wanna go through the school district, everything has to go through legal in the school district. We can't just go and say, give out this form. You know, it has to be, because then parents come around and say, well, you told me, or you did it at LISD, so That's why all these forms need to be approved.
Can I mention
Yeah.
something on that?
Of course,
Because I
of
wanna
course.
see why the schools do not provide those forms, because there's no like law or any policy right now in place. Our organization is actually working with state representatives and within the valley, the individuals from over there, to bring up a bill that provides resources to individuals that are about to graduate, that are special needs, to provide them with, information on Texas Workforce Commission, information on nonprofit organizations that are gonna help out, basically a packet as they're graduating, so you know what's available for after all. I reached out to my secretary to see if I could get the bill number that we, if I could get y'all the bill numbers, maybe I could contact your representative and provide more support on that to get that going. And maybe that could be another part, like, where local police departments can input that form into those packets that are being sent out.
Also, the police department also have, like we do for kinder, they can have a registration day.
Yeah, they did.
Hey, I remember years ago, when my children were very young, they had a registration in case they would get taken, and I would register my children. It was my choice, like, some parents don't wanna do it.
Yeah.
But have like a registration rally, we would be here at the civic center, when it was coming to register children. Because a lot of people are very careful about disclosing their children.
Okay, so let me reel you all back in. So I'm gonna read you a letter, okay, what I think. This letter would be addressed to Senator Saperini and Richard Raymond. I don't know if there's any other, I don't know if Representative King is also part of this area as well.
I've said senators, many people, so we can.
So on the 27th of January, the BRC met with several leaders of the Laredo Police Department to identify and discuss their policies and practices currently in place for the citizens that may not communicate fluently or may display behavior that is not typical due to their disability. We were glad to see that the police currently use several protocols to help their officers identify citizens with disabilities. Additionally, the committee suggested others that we were discussed during our next meeting, excuse me. However, during our meeting, when the committee asked how we could help the police with the challenges of dealing with a population with disabilities, they voiced that that having a local mental health hospital capable of accepting and admitting individuals with more severe disabling mental illnesses would help them significantly. Currently, the Mental Health Authority only admits voluntary admissions, and not those that are severely impaired, unable to function in the community, or are a danger to themselves or others. During a psychiatric crisis, these individuals require the police to oversee their care for many hours until the psychiatric ward is located out of town. Medical clearances are finalized and transportation arranged. This process requires the police to spend many resources in the form of man hours and officers removed from regular patrol duties to ensure the safety of mentally ill individuals until they can be transported to a private or public psychiatric hospital out of town. Having a local psychiatric hospital able to admit all patients, including the most severe and not voluntary admissions only, would assist the police and significantly minimize the level of resources required to fulfill this task. Thus, the BRC, whose mission is to advocate and improve the quality of life for individuals with disabilities, is requesting your assistance in improving the life of our citizens during a psychiatric crisis by receiving intensive crisis intervention services locally, and thus making it easier on the patient, their families, and the local law enforcement entities. Your assistance in this matter would be greatly appreciated. The committee is at your service if you need our assistance in this matter. So that's what I have so far.
If you could get the data from the police department, that would be even better, but that sounds good.
Yeah, yeah. I think it's just following his recommendation, that would be good, that's true. People like data numbers, but.
Yeah, and I can tell you, I started working at the center in 1990, that just tells you how old I am, okay? And some of you weren't born in 1990. This issue with psychiatric crisis has been there forever. Border Region has a crisis stabilization unit, okay, but it's not willing or it's not capable either because of the manpower or because of the way it's structured. Okay, it doesn't have the capacity psychiatric, psychotic, suicide, homicidal, they just try to send those for safety reasons, they rather send them to San Antonio or wherever they can find a psychiatric in a hospital that's set up for that. And so Laredo is not. And so that's a struggle that's been existing for the last 25 years. So how far are we gonna be able to push this? I don't know. But I can tell you that it's a ongoing concern at large for the community.
Maybe in this lifetime.
Maybe stated just what you said, that it has been an ongoing concern in our community for X number of years. However, the population is now, we can say, but now the population in Laredo is X number, whatever it is. And therefore, we feel that it is a, the situation is urgent, something like that. I have a question, do we have to go through the mayor or the city council before we send this, or can we just?
And you know what, Mr. Castillo, you hit the nail. You hit the nail right on the dot when you said, Board of Regent, I forget their name, has a unit, has it. But when this happened to Tito, and we called, the gentleman came over and of course there's my son trying to hit himself and everyone else. And the gentleman is like, has he said he's gonna commit suicide? And I said, well, no, he's not verbal, really. Oh, then I can't help him. And he turned around and left. His social worker then got there, and the social worker worked even closer. And it's Carlos, you all know Carlos. Okay, that's why I love Carlos, because Carlos came and he didn't say, I'm just a social worker. No, he sat down right there with Tito and he tried to calm him down. While the other gentleman said, no, well, he hasn't said he's gonna commit suicide, I'll see you. Oh. So I think it's just the protocol, the process that they have that needs to be looked at, tweaked. Yes, Major.
I think is that also the police department, if they're being trained on all these disabilities, per se, to handle these disabilities, they also need to understand that not every autistic child responds the same way. Not every autistic child is on the floor, or not every autistic child is nonverbal. There's some of these kids that are verbal, like our daughter is verbal, she can express her feelings and emotions very well. She doesn't do her typical thing that some autistic kids do. So I think they need to be trained that it's a whole spectrum. Like, not everyone is, just because you're approaching someone and it's marked there that he's autistic, that doesn't mean the child's gonna respond as your usual autistic child, per se.
Yes, sir.
And you brought up a good point in terms of like when you told us, like mentioned that you've seen this since 1990, right? When speaking like to like a politician, like personal examples are gonna like help out with like whatever you're fighting for, like whatever cause. I think if LPD could have some of their officers also reach out to their representatives, say like, hey, this is what we're experiencing in the field, is gonna add more weight to the request.
Or maybe somebody from their mental, and I know it's new, right?
Yeah.
It would be between the last 2 years, maybe I'm assuming that they've already seen some instances, and they can probably submit their own letters of, this is what we, noticed, this is what happened on this, this situation.
Basically, like it just doesn't have to be one letter, like if you bombard them with like tons of letters and like tons
That's
of
my
like
hope.
different, it's gonna bring up awareness at least to start the conversation.
Well, the health department,
Heriberto Ábalos, he's the mental unit supervisor for the crazy.
well, the health department, the billing section, that's where all the EMS reports end up. They should have a stat, or they can get the numbers of how many cases are psychiatric cases or mental cases.
I know you're right, there is a place where it even says how many individuals in our community have, disabilities, mental challenges.
Maybe that form needs to be revamped a little bit, and rather than just say mental a situation, it might be something else that's added to it, because there's different situations, so that it encompasses, everything can be worked, it's a working document, so maybe looking at that form and looking at what other aspects we can you wanna track statistics and you wanna do data, what might have been okay and back when that phone was created in 1987 or whenever it was created, might have changed, so relooking at it. Because I know I work, I'm an employment placement provider, I work with a lot with the AU population, and one of the things that happens is, I can tell you that I have individuals who have had severe meltdowns, but it has nothing to do with, but they come in and the officers don't know what to do. Some have been arrested and picked up, but when it's addressed, because it's more on the psychiatric, the treatment is different. So maybe revamping that form so that statistically we can come up with better numbers.
We could put it on the agenda and we could bring the form next time, but it still has to go through legal, through this, okay? And we could see it, yes, yes. And speaking about that, maybe, I know it's not time for the concerns and or the discussion, but we are going to go, and maybe as the members of Blue Ribbon Committee, you can go with us. We're gonna go to LC very soon to one of their board meetings, because what's happening with our kids, they have been pushing them out. Yeah, yeah. We're on the second one or the third one already, that he has been applying pressure, and
When you try to enroll.
well, they are enrolled, but then they push them out. Something happened with one of them, major meltdown in one of the classes. Professor tried to intervene, which is what we say don't do. Don't intervene if they are going through the meltdown, and it just made it worse. Now, there's another one, that she was taking 3 classes. Professor tried touching her again. We don't touch them, no. And then, instead of now taking 3 classes, mom was then told, let her just take 1 class. It's like, everything we're working for, it's like 2 steps forward, 3 steps back, everything. We go back to the 1900s. We do, in cases like that.
Yeah, I talked to somebody with the city who said his son was pushed out of LC in a way because of an English class. Was able to get through everything, but couldn't write the persuasive paper. He's like, I could help him with so many things, but he just needed this one space, and because of that, they sort of were like they stopped him at that level. Isn't that crazy? And this is a guy who's, like really well educated guy in our city, who advocates for the youth everywhere, but his own son could not seem to get past this barrier, a minor barrier, which I think is like a professor decision, like
I think so.
a choice, right?
This is a discussion that could go on for days. Okay?
Yeah.
And, but we do need to move on, but I do wanna tell you all something, okay? Whether an individual is identified as having autism, or an individual is mentally ill, or intellectually has some intellectual development issue or disability, what we all always need to understand is that not everybody in our society is in the same place we are. With the kind of knowledge that we have. And even when you have the knowledge, okay, and I can tell you all, sometimes you run into cases that are very difficult, very challenging. You don't know what to do, okay? As human beings, you just don't know what to do. And so we always need to remember that the individuals that are out there don't have the same training, don't have the same experiences, and so therefore it's not an excuse, but it's something that we need to understand that the only way that it's gonna get better is if they get massive amounts of training, okay? And the only reason why we talk about these topics about people with intellectual disabilities and autism and mental health and mental and depression is because we, as a society, we've advanced, we've moved forward, okay? Because many years ago, no one even spoke about this. It was like, a taboo, it was like, you didn't mention anything, okay? And today, the idea is to get your child out of the house and put them and integrate them into society, into the community. It's not about hiding them, concealing them, or protecting them at home, because that doesn't do anybody any good. And so it's just a transition that we have to go through as human beings. And we just are not everyone's blessed with the same talents of being able to identify special needs and how the treatment that needs to be provided. So acknowledge the losers, we just, our experience the losers, we just, we have to deal with very difficult individuals and challenges. And so, you know, I've always said this, I have a great respect for individuals with children who have special needs. You know, I've always told my wife, there's parents, there's good parents, and then there's super parents. And God made super parents because I think that you all have to deal with a lot of challenges that many other parents do not. And so that makes it very, very difficult, very challenging. And it's ongoing. It's not like for the next 5 years or 10 years. It's gonna go on forever, okay? And so as a parent, you're very concerned about what's gonna happen with them here, okay? I used to deal with people who were in their 60s and 70s, and they had a 30 to 35-year-old son, and they would tell me, Mr. Castillo, what's gonna happen when I'm gone? Who's gonna take care of my child? And so that's a real concern and real fear. And so, you know, just full trauma that globally, it's a big challenge all across. And so, for both as a parent and as a provider and as a law enforcement, and it's just a difficult topic to address and to manage. And so, I just wanted to say that.
I wanna add, you brought some things to mind right now, and I wanted to, for the committee to consider the possibility, not right now, but maybe in the future months, to create a train, you know how you have some sessions, schools have sessions where people come in and they're trained? Maybe we could consider something like that, where you have parents come in, maybe even individuals with disabilities, and say, this is what I have a need for. Maybe we bring them in and we inform, and we bring out those flyers and we send them out to the school districts, to to Valero Community College, all those places, and we tell them, okay, so you need knowledge, here's where we've created a hub for you to have knowledge. We're providing trainings quarterly, yearly, half yearly, whatever, but that's how we get educated. We go to trainings, don't we? So why not open up trainings like that, you know, throughout the year, or maybe once a year, but where they're provided the opportunity to come and listen to stories. I went to the gala and I listened to stories about parents. I didn't know some of the things that I learned that night. And if it's not brought into the public, say, don't hide them, then if you can't hide them, bring them in. Bring people in to hear stories like that, to learn from real life events. And it might make a difference, okay? It's still a choice.
I do want to share that we do have the All Kinds of Minds master plan, in which this plan does support businesses, local businesses, organizations, in which they are welcome to initiate this training that is provided through a trainer group. They do have a tier in which they do trainings, which the business is educated with all the staff in different levels. And the business, it's recognized also, but it is designed to engage the businesses in becoming more welcoming, supportive, and understanding of individuals with disabilities. With this initiative, yes, the business is trained, but also recognize how to respond appropriately, adapt their environment, and overall support individuals with disabilities.
And I think it's great. I think from a business perspective, it's a long time commitment, and a lot of business don't want to engage in that. So considering maybe the same approach with the same intent, but moderated or done a little bit different might be a better suit. Because I've tried to sell that, and I have a very difficult time in the businesses, because they tell me it's a lot of time commitment. Okay, so something to consider. Okay.
If I may, Mr. Chair. Sorry, hello, you all. I apologize for being late or not being present the last couple of meetings. Been quite busy. But in this specific realm, thank you so much for bringing up the All Kinds of Minds, and of course your comments and everybody else's comments regarding increased awareness. And so the All Kinds of Minds is asynchronous. It's on your time, but I do think that it would be wonderful, because of the experiences from individuals who, care for persons living with autism or persons themselves can take a look at the content also that we have, because it was developed 2 years ago, and we wanna stay current also with what is being experienced. This could potentially be our foundation, and it can go into a hybrid, where we can do these one-time events with our, program with Ms. Garmin, to have these in-person sessions, but then have the asynchronous as well. Because this is also a charge from our Laredo City Council. Our Mayor Pro Tem, Vanessa Perez, is firmly behind the All Kinds of Minds Master Plan, and we're looking at getting more businesses right now, or organizations overall, because it's not just businesses, organizations overall, to become educated in this realm. And we do have, if I'm not mistaken, about 15 that have gone through or some of the tiers, either they're bronze, silver, or gold, but we do wanna increase the amount of organizations that are out there. So if we can also, continue to advocate, as you were just sharing right now, Ms. Essie, that you push it out, please let us know if you need somebody to push it over the goal line. Count on us to continue to push on it with our team and with Ms. Godwin's team, and of course, all of our communications and promotions individuals as well, because we do want to continue to elevate the level of awareness and acceptance, and for the community to know that we are conforming to them, because they should not have to conform to our standards.
And maybe with that in mind, if I may, with that in mind, go to the businesses that we know our kids or some of these individuals frequent. Like, I mean, Peter Piper's would be perfect, because most of our kids love pizza, but maybe even the mall. Because I've gone to a tiny little store, I don't even know what it's called. It's a tiny little store and we can barely fit. I can barely fit, and my husband can barely fit, and he's smaller, and my tito is like, oh, de ladito. Imagine somebody with a wheelchair. They're not gonna be able to fit in that tiny little store. So maybe just start with some businesses, Ceci, and we target those businesses, Ms. Carmen. And then once we have them on board, okay, let's go for something. Maybe have some kind of plan, another strategic
Tacos
plan.
and drinks.
Tacos and drinks.
Always bring people in.
Fruit
I
and
just
plant-based
don't make
protein. But I really appreciate that, Ms. Ordonio, thank you so much, and of course, for anybody else who has additional organizations that you would like our team to go knocking on their door, please let us know. I mean, we are busy, but we wanna keep extra busy, because this initiative requires so much of our attention, and we are there to provide it and invest it too.
And I will, share by email, with Ms. Angie, more information and how to, navigate, the trainings. And if you do have any businesses that want to reach out to me, I am more than glad, to reach out to them.
And if I may petition one last request, if the committee would like a presentation of what those classes or courses are on train.com, so that the way everybody can be aware of what is part of the curriculum, we can have that set up for the next meeting via Ms. Carmen. And then of course we can see that there are these 9 trainings, there's something missing in this realm, let's see if we can start putting something together to ensure that we are also elevating the level of awareness in this specific element. So if you all are okay with that, but I can't make that motion, sorry. To instruct the health department
Okay,
to come back with a presentation for the next.
so we make that motion.
Sorry,
Yes.
I apologize for just coming in and starting to talk.
Do you know if the Department of Finance requested, do they think to promote the idea of a non-intensive psychiatric hospital?
Yes, so if I may, once again, Richard, we were up in Austin, and while we were in Austin, we were able to connect with the executive director of HHSC, which is the most wealthy organization or department entity of the state of Texas. $48 billion is their annual budget. And within their budget, prior to the meeting, I went through their strategic plan. And and within their strategic plan, there is a specific goal, 2.A.2.3, if I'm not mistaken, but ultimately that goal says that HHSC must increase psychiatric bed capacity by 40% in the state of Texas by 2029. That's like right around the corner.
Yeah.
And what I let them know is that it mentions nothing about rural areas or the border. That this is all basically for metro.
That's what I thought.
And I spoke to the executive commissioner and let her know that's wrong. I mean, they have a lot already, these metro areas, and of course, they're still trying to care for their population with having state-funded services, but the state needs to reevaluate their position on metro areas and bring them into rural, and of course, have something on the border. There's nothing on the border. From El Paso to Brownsville, nothing in the realm of psychiatric care from the state of Texas. So she took a breath, and I appreciated Commissioner Young for hearing us out and us being very bold in that meeting. We did have members of our Laredo Chamber of Commerce that were present, that were even sidelining and pitching a potential public-private partnership to have the state build the hospital and a private entity come in and operate. So that was something that can be a little difficult with public funds and a private venture making profit, but it's still some type of pathway forward. And I can tell you that there was a $100 million rider included into the budget process. Will it be funded? We'll find out in the next couple of months, which would provide a brick and mortar for 20 inpatient bed facility here in Laredo. So we're very hopeful that that does come to fruition, but know that you can continue to count on us to continue to push that forward because we are so underserved. I know that goes back to the workforce as well. We would need to have the workforce, but we need to start with the shell at least and know that we have this building, 20 beds. I think it's very, very manageable and maybe potentially even be maxed out a couple of times here in our community with the need of at our current capacity. And so we're very pleased after that meeting. It was a wonderful meeting too. I did get feedback from the commissioner of the health department of the state of Texas, which is Dr. Schuford, and then of course our Laredo Chamber of Commerce members letting us know that we pushed hard and they felt what we needed. Yes, ma'am.
I really need to know, and I need to ask you, what steps we can take to advocate and to ask for that type of a setting.
And
a
so,
psychiatric clinic for Laredo, specifically for Laredo. I mean, it's all good, well, we have many for Texas, and like you said, it's usually going to the same people, but we need to advocate for our community, and I'd like to know what we can do to make sure that we are the wind beneath your wings, that we advocate and that we push for it.
well, you all are definitely our leaders first. Each and every one of you all here around this table, and thank you for always being very supportive of elevating our status here in Laredo. The most important thing that you can do is continue to have conversations with Representative Raymond, with Senator Zaffarini, and Representative McLaughlin, and let them know that that rider was included and you want that to come to fruition.
And specifically, what do we call the rider?
It was a rider for a psychiatric mental health annex of the San Antonio Hospital for $100 million.
That's a lot of money.
Not if it doesn't come to us.
Well, true.
And if it doesn't go again, if it doesn't get picked up this round, we'll go again the next round, we'll go again the next round, and we will say it until we see results come in to the community. But more voices make us more powerful.
Maybe taking, like, Ms. Ceci mentioned, taking some of the parents and give them their testimonials, because that's when we get them.
Absolutely.
Yeah.
That's very important.
wasn't introduced in the form of a bill, but a rider, and a rider can be picked up by a bill and included into the bill. So we're still following to see if it was included in the bill, but as Ms. Orduña mentioned, if it is attached to a bill, then we can go and give public comment in Austin. Let them know we absolutely need it. Sorry, that's all.
Still 22, it's still 22, maybe we should move on to new business.
Next item is the strategic plan. You all have copies of the 4-page document that I asked Angelica to provide. It outlines many of some of the subject matter that you all spoke about earlier, about training for the group, training for the police department, okay? How do we enhance the job opportunities for individuals with disabilities? And so that's something that this needs further discussion in detail, but this is a very broad, very general outline, specifically having to do with employment, having to do with training, and public awareness. And so, I don't know if this has been sent to you all, but I had Angelica give you all an actual copy and send it to your emails as well, so that we can look at it and maybe we can discuss it next time in more detail.
Yes.
Okay. Next item we have is presentation reports and updates on public health autism surveillance program by Alonso Rivales.
Alonso is not here, but I will go ahead and provide some updates. We're very excited about the data that has finally been compiled by our ADAM team. And so, in a few short hours, this news release will be going out to the community, so you all are hearing it first. I'm gonna read it verbatim to you all. Laredo, Texas. 1 in 103 of 8-year-old children were identified with autism spectrum disorder by the Laredo ADM project in 2022. According to the analysis published on April 15th, a few short days ago, in the CDC's Morbidity and Mortality Weekly Report, Surveillance Summaries, this percentage is lower than the average percentage identified, 3.2% in all 16 communities of CDC tracks, highlighting the variability across ADAM sites. Findings from the Laredo Autism and Developmental Disability and Monitoring, which is the Laredo ADAM network, offer clinical insights about the number of children with ASD, the characteristics of those children, and the age at which they are first evaluated and diagnosed. Key findings from the Laredo data. The median age of autism diagnosis in Laredo ADM is 69.5 months, later than other ADM sites. This shows opportunities to improve early identification. Autism prevalence in Laredo ADM is higher among boys than girls, consistent with other ADM sites. Laredo ADM reports show the lowest autism prevalence among all ADM sites, which could reflect underdiagnosis in our community. This report, co-authored by Kathy Chavez and Dr. Montes, Angel Montes, from the City of Laredo Health Department, represents a major milestone for our region. Their contributions highlight the department's leadership in advancing public health research and demonstrating a strong local presence in this nationally recognized CDC publication. This is the first time autism data has been made available for the Laredo community through the ADM network from CDC. Local health and education leaders can use these findings to better understand the needs of children with autism. By identifying gaps in early diagnosis and service access, the data is helpful to guide next steps, such as provider training, community outreach, and a stronger referral system to support early identification and intervention in Laredo, Texas. And so this is going out to the media today. The actual report will have a beautiful infographic provided by CDC by next week or the week after. And we're gonna go ahead and make sure that we email that infographic to you all so you have it, and we'll also be releasing that to the media.
I was telling the committee, that in the morning, I just saw a brand new statistic, 1 out of 31. So because of all this, that was gathered. It used to be 1 out of 36, now this year it's 1 out of 31, right now.
My son was not diagnosed till he was almost 5 years old, and I had gone through his pediatrician. We had already started daycare. We had already had teachers, doctors, everything in place, and he did not get diagnosed until he was 5 years old. He missed out on a lot of early interventions.
Yeah, my daughter got diagnosed at the age of 10. It took a long time, and I had to go to San Antonio to get the diagnosis, because she kept getting a misdiagnosis here with some other things that were not even what it is, because we don't have, Laredo doesn't have a lot of pediatric neurologists, there are a lot of pediatric psychologists, there's only a very limited amount here. So her neurologist is in San Antonio, the psychiatrist is in Corpus. We've had to go out because it took us long.
And unfortunately, Laredo sometimes suffers from, it's an underserved medical community. And so it's amazing that we have doctors of all kinds, but there's some certain specializations that are just not here. When Dr. Gonzalez was here, I used to ask him, because at that time I had a friend my same age suffered from a stroke. They couldn't treat him here, they had to take him to San Antonio. Dr. Gonzalez told me at that time, everyone was sent to San Antonio. I don't know if it's still happening today, but Laredo's just medically not prepared to deal with the initial oncoming of a stroke. And so it needs to be they need to be sent to San Antonio to receive appropriate diagnosis before we can send them back to Laredo for treatment.
And so if I may, you are correct, we are a medically underserved community, and we are actively trying to repair the designation with, of course, our primary care family medicine residents that are here in the community, which fortunately we're having some of them stay year after year, which is wonderful for us here. But we know that that's just step one, because we need to get into the ISTs, right? The urologists, the nephrologists, like all the specialists. And with that, potentially, as I was chatting, and I don't know if I should say it already, but I was chatting with Councilmember Alisa Cigarroa, and she was mentioning about potential partnerships with UISD, LISD, LC, Webb County, and City of Laredo governing entities that can Captain Planet combine powers, forces of financial support to put into a pot, basically 200,000 each. We can bring in 2 psychiatrists that'll be here. They'll have, of course, the support of, or they'll have the insured clientele from those organizations, but then they're able to grow the fabric of our mid-level psychiatric FNPs that can help support with diagnoses in this area, because we do have that program at TAMU that has no preceptors to be able to continue to help develop that. So that is an idea we've been shooting around. Of course, it'd have to go through formal proposal, interlocal agreements, have school districts, the college, the county all come together, so that way we are coming together to bring the talent to Laredo, because we have to be highly competitive as well. I want to be very transparent that in other jurisdictions, say for instance San Antonio, Houston, Dallas, they do pay well, and they have a lot more amenities to offer these individuals, and that's where they go. So if we do want to bring in the talent from outside Laredo, ideally we'd like to grow it, because when it's homegrown, it stays. But we have to bring in the talent, it's going to cost. And so potentially 2 psychiatrists coming to Laredo to help support us here would be in the realm of $1 million for those 2 salaries, because they make pretty good money, between $300 and $450 in these other cities. So we're gonna have to be looking at $450 to $500 to recruit them here. But that's in a beautiful utopia world that could be tomorrow. But of course, with government entities, it takes some time to comb through it, to comb through finances, to get approvals through councils and boards. But it is just a thought that we've already started to formulate to see if we can put together the entities that have funding, the larger funding sources, to Captain Planet and come together. have to excuse myself. I'm gonna run to my 1 o'clock. I apologize for coming in late and leaving early, but please know that anything you'll need, I'm a phone call, email, or text message away.
Thank you. Last item is report on family support for children and young adults with special needs program update by Carmen E. and
Well, I was going to share the information for their All Kinds of Minds master plan, which we just discussed, and continuing with that set of your collaboration in continuing with that. And also, aside, I do want to introduce Ms. Rebecca Segura. She is the case manager, new case manager for the program. So she will be working along with me the program, and I just wanted also to introduce her. So that it was my information today, that we wanted to continue with that initiative of All Kinds of Minds, and for next meeting I will do that presentation, how to navigate, and the trainings that are available for the local businesses and organizations to participate in that.
Thank you. Item number 6, any announcements?
Yes. I'm Jenny Sanchez, a special needs manager with Laredo Parks and Rec. I love this conversation. It is, I'm looking forward to be part of the moving and shaking that's happening in the community. I wanted to announce, and I don't have the pamphlets, Mr. Barron couldn't make it. Joe Barron partnered with Laredo Parks and Rec and Councilman Gutierrez, and we are having a big music festival on April 26th, and it's in collaboration with UISD, Michelle Molina, and it's gonna be like 5 to 11, okay? So you got all day, it's gonna be a combination of high school bands, mariachi, drum lines, and some local bands, and then a DJ from Austin. So it'll be like 6 hours of entertainment, free of charge. You just come and join us at Bartlett Park. And if anybody's interested in hosting a booth, you can just contact me. I sort of sent out something earlier, but with that, we're just looking for booths, informational booths between 5 and 7-ish. You don't have to stay till 11 unless you want to. And it's going to be a great time. And some of the sponsorships coming in are going to pay. We're looking to support. I don't know, I have a lot of love for LISD and UISD. In this case, Mr. Barron was looking to support UISD's sensory rooms. I know we're hoping to do something later with LISD, because everyone needs the support. But anyway, so it's gonna be a fun time, music festival, April 26th. It's not this Saturday, but the following Saturday at Bartlett Park. I also wanted to say that as far as Parks and Rec goes, as I was leaving, Ms. Stanley sort of okayed a flyer, so I didn't get to make copies of it. I'm gonna be pushing out there on our Rec Center Facebook page that we are looking for instructors and teachers or coaches for adaptive classes. So if you have a special ability or a special hobby that you would like to share, we are looking to contract people in weekly classes. I'm working on my funding, honestly, for this year, but for next year, we're adding more funding to my program. So this year, to finish off this year, it's a little minimal, but it's something we are, I'll be putting that out there in the next meeting we have. I'll give out some flyers. As well as we're working on adaptive summer camps, which again, based on, I came in late, so the budgeting is a little smaller, but I'll be doing 4 mini camps throughout the summer that are adaptive in nature, and the next time I come over here, I'll give y'all. But I just wanted to push that out there, that we are working on it. It is a matter of getting the monies out there, and the Parks and Rec directors have been very supportive, and they're looking to push this forward. The other thing that's happening is at Haynes, I was able to put forth a PO this past month of about $12,000 in supplies for an adaptive gym that'll be open hopefully by June, and we'll give y'all invitations for our grand opening. So it'll be a completely adaptive gym at Haynes at the lower level. We have some fun things that are happening. We are looking to create shifts and change in the community. It's been a long time coming, and parents and family members of persons with disabilities, I know it's been tough. And, but we're looking to get there, so just know that we're doing stuff, you know? So, we got lots of that.
Any other announcements?
Just a question, the letter that you read to us is great, what are we gonna do, are we gonna go ahead and send it on behalf?
Yeah, let me put the details on it and then we'll just.
But we are gonna send it.
I think last it out. Throw it out there.
Yes, sir.
Oh yes, I never was able to give my updates. I apologize. I had to step out to a quick meeting at 12, and that's why I took off earlier. But for those of you who don't know me, I'm the epidemiologist for the Autism Surveillance Division here at Laredo Public Health. And what we do is our grant is funded by the CDC, and we go ahead and look for the we get local numbers and local reports, and we go ahead and send that to the CDC to create a report in which we find the characteristics and number of children. Well, other way around, sorry. Number and characteristics of children with autism within our community. We're one of 16 sites across the U.S., so we're very lucky to be part of this. Just yesterday, so it's really big, that's why I had to step out, our MMWR report. So you go to the CDC website or you go to MMWR, have more information next time. I know we're kind of getting close, 30 minutes past. But basically the report was published yesterday, in which Laredo was published as well. So we have our web county numbers. But I can tell you so far, just based on what we saw, the prevalence rate did change from 2 years. So our report is based on the year 2022. The report before that was 2020. And then before, the prevalence rate was 1 in every 36 children, right? So 1 in every 36 8-year-old. This year, based on the new numbers, it's 1 in 31. In Laredo, we did have the lowest prevalence, but the question is why? So that's where we have to reflect back and look at our community and say, you know, lack of resources, lack of funding. Also, we also have based on the 60 sites, we had the highest age of identification. So we're looking at different rates between different communities across the U.S. and which Laredo had, I believe it was 69.5 months, so about 5 years and 7 months or so. That is the rate. So basically when we're going into the school system, that's when we're being identified, and you know, that's when important things like ECI come to. That's where you have to go and promote that. So these numbers, they're to go ahead and show where we need to allocate our efforts, and also to be used for advocacy within our community. So with that number right off the bat, you can say that based on the 16 sites across the United States, we are identifying our children at a much later age. So that's when we're like, okay, now we need to put more emphasis in ECI, and you know, we're getting these resources to the families that need it, and so on and so forth. There is a community report that's going to be published hopefully soon. We're talking about it right now. It's still being approved through like the actual government itself. But that report is a visual representation that will have graphs and everything, and it'll be a good way to disseminate that information to community, but also invite you to go ahead and look at that report. Right now, again, go to it's MMWR, go there, and it's the first thing that's right in the front, the actual report itself. Or you can go to the ADAM network, that's the team I'm a part of, ADDM, Autism and Developmental Disabilities Monitoring Network. That is our project, and you could also find it there as well. And next time, I'll go ahead and share more information, and once the actual community report is published, and we have more, I guess, public-facing, I guess, forms of communication of, like, you know, documents, we can go ahead and share that. I'll share that with Ms. Angie and Ms. Erica, and we can go ahead and disseminate that to the rest of the Blue Ribbon Committee and the partners as well. So I just wanted to cut it a little short because I know it's pretty late, but it's really good news. We're all really excited, and hopefully next meeting we can share more into detail about the numbers.
Thank you,
No problem.